live stream till late this evening because of all sorts of fun stuff throughout the day. You might hear my dog snoring in the background. You may hear my cats or see the cats right there as you see them walk by right there. But I thought tonight I would talk a little bit about vitamin A. I've had a couple people actually message me and say, what about vitamin A? And there's a couple people who have been, apparently there's a candidate for senator who's promoting his approach to treatment of COVID and prevention of the diseases that are out there and all those kind of things. So I thought I would touch base on some of the information that he's talking about and why I disagree with it and some concerns that I have with it. Anyway, so I thought we'd talk a little bit about vitamin A, what it actually means. And so the first thing I thought I would talk about is what exactly is vitamin A? Well, vitamin A is basically a retinoid. It's one of the fat-soluble vitamins. It's found in leafy greens. It's found in the orange and yellow vegetables. Carrots have it as well. And it's also found in eggs and cod liver oil. So if you're doing a low-fat diet, but you're getting enough leafy greens, usually you get adequate vitamin A. It's not a big deal. But if you're doing a low-carb diet and you're not eating a lot of your colorful vegetables, you're going to get it in leafy greens. You're also going to get it in eggs, and you'll get it in fish oils as well, which is actually just fine because that's you should be just fine with that. If you had 3 eggs, that provides about 1,000 international units of vitamin A. If you had a cup of leafy greens, it gives you ample amount of about 10,000 to 18,000 international units of vitamin A. So you're actually doing great with that. So if you're eating a normal diet, you're actually getting all the vitamin A you need, and you shouldn't really need to supplement it. There's a candidate for senator in, I think he's in Massachusetts, that's now promoting, he's an MIT grad, but he's not a doctor. He's a PhD, so he calls himself doctor, but he's not a physician, and he doesn't actually treat patients. And he's promoting huge amounts of vitamin A intake. And my concern is that the challenge is you should actually not take in more than 40,000 international units per day. That's the big challenge. I should say per day there. It says just per, but there it is, per day. No more than 40,000 international units per day. The reason is that when you hit 50,000 international units, your risk of toxicity goes up, and that's the big concern. So what is the challenge? What's the chance of toxic vitamin A levels? Let me put them up here on the screen so you can see them. And I think this may scroll. Number 1, liver damage. Number 2, blindness. Number 3, hair loss. Number 4, vertigo. Number 5, vomiting. And if you're pregnant, significant birth defects. So if you're doing more than 50,000 international units of vitamin A per day, this is going to cause some major problems. This particular gentleman, who is basically a politician, not a physician, is promoting 400,000 international units of vitamin A in his protocol. And the concern is that's toxic levels. I hope he has a big malpractice plan, because promoting that to the average person is, in my perspective, malpractice. But he's not a physician, so I really wouldn't take his advice. And I realize it's being pushed around the internet, so I'd be very, very careful with it. Like if you're eating a standard ketogenic low carbohydrate diet, you're probably getting all the vitamin A you need. But if you're worried, you can supplement 10, 20,000, up to 40,000 international units per day should be okay. Now, if you're deficient in vitamin A, and I think part of his claim was that many of us are deficient as we get older, our thyroid slows down and we don't make enough. That's a bunch of hogwash. The challenge is that if you're eating a good diet, and your diet doesn't consist of McDonald's every day or Burger King, then you're probably not going to see the night blindness, the dry eyes, or the keratosis pilaris. Now, I have a number of patients that show up in my office, and they aren't eating a good diet, and they end up having keratosis pilaris. And this is a vitamin A deficiency. And so we want to make sure that those people are actually getting enough. Let me show you what keratosis pilaris looks like. These are those little pimply-like looking things on your shoulders or your arms. You can actually get them anywhere on your body, but this is a side effect of vitamin A deficiency. If you have this, it's where the hair follicle kind of peaks up, and you may see a little white pustule, you may not. But if that happens to you, you probably need more vitamin A, and I would supplement somewhere between 20 and 40,000 international units per day, but I wouldn't do more than 40,000 international units because of its potential for toxicity. Like I said, you don't want to be toxic, because if you do too much, you'll see these kind of things happen. Again, liver damage, blindness, hair loss, vertigo, vomiting, and birth defects are the main side effects. So I'd say be cautious with vitamin A supplementation, because it can be a problem. So I would avoid it like the plague in regards to excessive amounts of vitamin A. Vitamin A is fat soluble, so if you're using, like I said, eggs and cod liver oil or fish, you're getting adequate, and then you're getting it through leafy greens as well. So not a big worry. That is your 5-minute vitamin A blurb. If the person is not a physician and they're running for Congress, my suggestion is don't take nutritional advice from them. That's going to be my new mantra here. If they're running for Congress, don't take nutritional advice from them. It's just bad. I'm amazed. Anyway, hey guys, I'm going to say hello to a few people here. Good evening. It was a good day. I actually had the day off, and so I spent the day working on the farm, and I'm just now sitting down to take care of my paperwork and some office stuff. Let's see here. I'm going to scan through and just see if there's any questions. It's good to see everybody. There's Kathy and Sue and Kathy and Vicky and Wynette and Berkeley. Let's see. Hi, Doc. I was about to go to bed because I thought you may not show up tonight. Well, Berkeley, I showed up. I'm here. It's late, but I showed up. How are your office staff who got ill? They're actually very well. My office, thankfully, none of my office staff is COVID positive, so I'm grateful for that. Their tests all came back negative. We've all been negative, so it's great. I'm very happy with that. I have some patients that are positive, but our staff's been negative. Can night blindness be reversed? Yes, it can, Wynette, if you supplement adequate doses, but not toxic doses of vitamin A. What about iodine? Don't use iodine salt. If you're using sea salt or pink Himalayan salt, you should be getting adequate iodine. So not a big deal there. Does it itch at all? Keratosis pilaris can itch a little bit, Julie. Yes, that is a possibility. Just joined. Hope you're not too late. Well, Marianne, if you missed the first 5 minutes, I talked about vitamin A toxicity and some of the crazy recommendations of people out there telling you to megadose vitamin A. So be wary of that. Go back and watch the replay if you haven't seen it. Staying up waiting for you. Oh, thank you, Gail. It's very kind of you. Let's see, Doc, glad you're well. Yes, I am well. Yeah, leave it to politicians to make us sick. I know, isn't that craziness? What are your thoughts that the ventilators are making things worse? So the challenge, Kathy, and again, I'm not an interventional ICU doc. I'm a family practitioner, so I don't run ventilators as a normal process. But what I'm hearing from those in ICU physicians is that when I was in residency and when we ran vents in the ICU, and I don't and haven't for a long time. But when I did, we know that if the person's on the vent for longer than 5 to 7 days, their risk of ARDS, which is acute respiratory distress syndrome, and damage to the lung goes up. So the longer you're on a ventilator, the longer you have problems. The reason they're using ventilators for these COVID-19 patients is because it's the easiest way to get the adequate oxygen to them and to keep them alive, because they just can't oxygenate well. Now the question is, can they not oxygenate, or because they can't transfer the gas through, or can they not ventilate, meaning they can't pull the carbon dioxide out? There's some implication that it's one of either. The concern is, and the interesting thing is, that when you give these patients melatonin and you give them vitamin D and you give them my mind is just going blank on me. The adequate supplementation for those components, the vitamins, those type of things, that you actually allow them to function better. They're able to breathe more effectively. They're actually able to do much better in that regard. And so the issue is, how do you is it? Well, a couple of docs are saying it looks more like acute mountain sickness than it does true ARDS, and that what looks like a pneumonia on both sides. So they suddenly have fluid that fills up in the lung and they can't breathe. And it looks like a bilateral pneumonia, or a pneumonia on both sides. So they're putting them on the ventilator, because that's normally what you do if you had a severe respiratory failure because of pneumonia. You ventilate them until that infection improves within a few days. The challenge is that these patients have these prolonged cases on the ventilator. And as that time prolongs, their lungs get damaged by the ventilation, and then that causes an ARDS. Is it the chicken or the egg, or the egg or the chicken is the challenge. What they're finding is that some forms of medication that they're using with adequate supplementation is actually very effective for these patients, and they actually do very well in that regard. So that's So we're giving adequate zinc, we're giving adequate vitamin D, we're giving adequate melatonin. Those actually help both carbon dioxide and oxygen transfer back and forth across the membrane, and they're finding that that's actually helpful. And so I hope that answers the question. If that makes sense. And so is the ventilator a potential problem? Yes, but some of these patients, that's the only way to keep them alive. So you're putting them on a ventilator. The challenge is, does everyone who starts to get progressively worse go right into a ventilator? And a lot of doctors are saying, if we can keep them off the ventilator longer, they do better. And if there's some way to help that, using various medications. And then right now they're studying all those medications, trying to figure out which combination seems to be the most effective for those that are severe. I have Sjogren's. Is vitamin A involved in my dry eyes? Sjogren's is a different connective tissue disorder, which relates to the dry eyes there, Berkeley. But I would be inclined with my patients who have Sjogren's, I check their vitamin A levels to ensure that they're adequate. Now, the challenge with checking the vitamin A is that the liver stores vitamin A, so it doesn't always give, the blood testing doesn't always give you an adequate picture of whether you have adequate stores of vitamin A or not. But most rheumatologists will use vitamin A as a supplement appropriately in appropriate doses for that, if that makes sense. You're right about the poll giving medicine. Oh, the politicians giving medical advice. Yes, I know. I don't understand why politicians give medical advice. It's kind of craziness. Sarah, I'm getting, let's see. All right. Getting text. Hello, Patty. How are you? Negative is awesome. Yes, it is, Belinda. We like that. Let's see. I'm going to just scan through here. I know it's late. Yes, my cats are funny. My dogs are funny. My goats are funny. Well, you have animals because you get to watch animal behavior, and it's actually interesting. Bill Gates and politicians are trying to make us sick. The challenge is that a lot of people like Mr. Gates and a lot of our politicians, they base a lot of what they say and do on their ability to profit and in ways that they think are being helpful for the country, but not necessarily not. Oftentimes, what they think is essential that fills their pocketbook it may take away some of our liberties, and that's one of the things we have to watch for. You are welcome, Paula. Let's see here. How much melatonin do you recommend? I recommend somewhere between 5 and 10 milligrams per night, Gail. Evening from Oregon. Yes, I'm glad my staff is doing well. Thoughts about milk thistle and elderberry. So I don't like milk thistle. It actually causes more liver dysfunction and problems than benefit. A lot of people use milk thistle to cleanse their liver. I will tell you that it actually damages more livers than what I see in my office. If you want to cleanse your liver, fast for 24 hours. Best way to cleanse your liver and your colon, fast for 24 hours. That's the original cleanse. It works effectively. Milk thistle actually irritates a lot of people's livers, and so I'm not a big fan of using milk thistle. And elderberry has been shown, although it improves some components of the immune system, elderberry has been shown to actually make things worse with COVID-19. So I don't recommend milk thistle or elderberry ever in that regard. Hello, is it Morris? No, Chris. All right. Any other questions, you guys? These are good questions tonight. And I realize it's late. I just want to make sure I didn't miss anything at the top here. I scanned through pretty quickly because it's late and I didn't want to keep you all up. Hello, Crystal in Shreveport. It's always good to see you. Yes, Kathy, it's crazy how much misinformation's out there. It is nutso. I think I got all those questions there. I realize it's late and some of my followers are probably in bed. So I'll roll this over to YouTube and you guys can watch the video on YouTube. Check it out. I'll give it a second. I know there's a slight delay with my software and pulling from Facebook. There, see, here she is. Allison says, joining again from Okinawa. Oh, Allison, konbanwa, genki desu ka? I hope you're having fun in Okinawa. Made 60 masks for the Marines here. Wear them on base. Awesome. I lived in Okinawa City for a while. It's awesome there. We have to wear them on base now. We're out of fusible interfacing. Oh wow. What else can you use other than fusible interfacing? You know what? I had one person use a coffee filter. I think that might work well. I'm trying to think if there's anything else. I'm not a seamstress, so I don't know what else to recommend other than you want a very fine weave of a fabric, and you probably know better than I do on that. Let's see here. Do you think your multivitamins would be a good source for someone who absolutely, Audra. The multivitamin that I use, I designed specifically for those with prediabetes, metabolic syndrome, diabetes, insulin resistance. We put all the adequate vitamin supplementation in there that you need to balance your diet, especially if you are in that that group of people, which is roughly 85% of the people that I see that have that pre-diabetic or metabolic syndrome component. Can berberine cause heart palpitations? If you take it on an empty stomach, Andrea, it could cause a little bit of a lowering of your blood sugar and could cause that, but not normally. Saving this for later. Can't listen now, but my mom has RP and Usher syndrome, and I give her high vitamin A. So yes, vitamin A can be, doses of vitamin A can be used to treat certain things, Jen. And there are higher doses we can use for treatment for certain periods of time. Your doc will help you understand that. But just giving the general public recommendation of taking 50,000 international units or more, in my perspective, increases the risk of toxicity significantly. Hello, Crystal. It's good to see you. How often can you get COVID-19? We don't know that, Kathy. No one actually knows that yet. Allison, if the fabric is thin enough, double it up. There's somebody, Vicky, that can help. I have melatonin with monk fruit in it. I would actually throw it out and find some melatonin plain. Monk fruit is a sugar, and it's a form of fructose. I don't recommend it, Patty. Do you have a zinc in your multivitamin? I do. It's not a huge amount because zinc can displace magnesium and copper. So we don't put a huge amount of zinc in there. We have about 15 milligrams of zinc in there. You can supplement up to 30 milligrams is the recommendation I tell people. In my vitamin, it's about 15 if you take all 6 capsules. I bought coffee filters and used, say, HEPA vacuum. Oh, yeah, HEPA vacuum cleaner also works too. Yes, thank you, Gwen. That's a good idea. Will it take you out of ketosis? Will what take you out of ketosis, Patty? I'm not sure what you're asking there. You'll have to remind me what you're talking about. 911 Peloton interfacing iron-on. Not sure. That must be a seamstress talking to the group there about the masks. He said in another video he doesn't promote monk fruit. Oh, yeah, I don't promote monk fruit, Kimberly Joe. Let's see. I don't like it. It kicks me out of ketosis every time. All right. Should you supplement with probiotics? I don't usually recommend supplementing with probiotics unless you know you have a deficiency. If I give someone antibiotics, I will give them probiotics to take for 2 to 4 weeks. But pushing continuous probiotics into the system, in my experience, is just creating really expensive stool. It doesn't help beyond a month. There's no data that I've seen up to this point that tells you that supplementing a probiotic beyond a month gives you any benefit. What can you tell us about glutathione? Linda, that is a whole other topic in and of itself. Glutathione plays about 12 different roles in the body and in regards to metabolism, burning of fat, immune system, things like that. That is a whole other topic, and maybe I'll do a video on that at some other point in time. Allison, let's see, says, some vacuum bags are good. Oh yeah, they can be for masks. When fasting, do you continue to supplement? I don't normally take my supplements during the fasting because the higher the B vitamin content can make some people nauseous. So I don't usually tell people to take their vitamin during a fast. Which vitamins do you need when your fingernails break and peel? Well, that one can be a number of them, Terry. Biotin is often the most common, and biotin is vitamin B7. Biotin actually helps to stabilize the nail for a lot of people. And some people actually notice that well, I think B12 and B6 for some people it can be helpful, but it's usually biotin in many cases. Let's see, mine are thin too. Then you need to eat more eggs and eat the yolk with it. Does your family fast when you do? Yes. Well, my family, from a religious perspective, we usually fast once a month. Sometimes I fast, and my family usually eats about the same way I do. So they get up and their first meal is usually not till 11 or noon anyway. So they often do intermittent fasting themselves. Has Plaquenil been proven effective for COVID-19 treatment? Debbie, it's still under study. There are multiple, I think there are now 3 small studies of, I think, between 20 and 30 patients that showed it to be beneficial in combination. There was one study that showed it not to be beneficial. So, and there are currently trials being run right now. I think mainly in New York is where they're at, and I have not seen the results or data on that. There are lots of rumors, lots of people implying small case studies in effect that way, but hope to see the answer coming up. We can't find it anywhere. Can't find what, Allison? I'm not sure what you're asking on that one. I keep my A1C below 5.6 for a year and 3 months. Good for you, Terry. That is awesome. Congratulations. Does salt and coffee cause kidney stones? Well, it depends on if it's instant coffee, it very well can, Ed, but regular coffee, as far as I know, does not, and salt does not. The kidney stones are usually driven by something that either raises your insulin and or stimulates the increase in uric acid or calcium oxalate. And that's often driven by fructose, alcohol, or high fructose corn syrup. What kind of magnesium to take? There are multiple forms of magnesium, Sean. The one that doesn't cause diarrhea is magnesium glycinate. Magnesium glycinate. If there are a bunch of other types, depending on what you're using it for, you can pick it based on that. Let's see. For those of us taking Plaquenil, are we safe from COVID? Debbie, I don't necessarily know if you're safe. We know that Plaquenil suppresses, as far as we understand, a component of the virus either in replication or in binding. And I'm not totally sure we know that answer fully. That's what I've been hearing and reading. So the theory is that it possibly could give you some safety. But Plaquenil also has some immunosuppressive effect too. So I wouldn't just hang out there and go kissing all the COVID positive patients. So be cautious with that. Best kind. Yes. Let's see. I would love to. Sean, I guess you're asking about the best kind of magnesium. Well, any magnesium is great, but the challenge is magnesium has to be bound to a salt because it's a metal, and in order to be absorbed into the stomach. So there's a whole slew of different forms of magnesium and the way they're bound. The challenge is that magnesium can cause looser stools, and depending on the type of salt that's there, it can stimulate increased looseness of the bowels, depending on the type of magnesium salt it's bound to, if that makes sense. I would love to hear a live on anything on glutathione and what you may or may not know about MTHFR mutations. Julie, I have written about MTHFR mutations, and I've actually done, you need to go and watch my YouTube videos because I've done a whole YouTube video on MTHFR mutation and how MTHFR and what it does. So go check that out. I've already done those. Go to my YouTube channel. It's youtube.com/Dr Nally, or go to my website, docmuscles.com, and type in MTHFR, and you'll find it there. My hometown pharmacy said zinc, melatonin, D3 have flown off the shelves. They have, yes, Barbara, it's hard to find them. A lot of people are taking them. Can you take or eat to help your tendons? I'm assuming, is that tendons? Well, number one, Terry, a good diet. Number two is adequate protein. And then I guess the question would be, what's the challenge with your tendons is what I assume you're asking. That could be tendons or tenants. If you have a rental property and your tenants need help, I don't know what to say there. Masks, cotton, t-shirt material plus cotton fabric. I guess Muriel is adding something there. Okay. You're welcome, Debbie. Top 3 supplements you recommend to your healthy patients looking to boost immune support during this time period. My vitamin, melatonin, and if they're insulin resistant, berberine. Those are the 3 things that I'm recommending to all of my patients. Any news on those taking Envito and Tevio? I have not heard any on that one, Darla. I don't know much about that one currently. That's not one that I've seen a lot of information coming out on with that one there. Let's see, what brand of D3 is the best? The kind that actually fits your pocketbook, Kathy. Is Mahoney with cellulose magnesium steroid okay? I'm not sure. Patty, I'm not sure what Mahoning is. That's a new one to me. Not totally sure what that is. Terry said yes. I'm not sure, Terry. I'm not sure what's going on there. Miranda's talking about biotin. Your joint. I'm assuming the tendons in your knees you're referring to. Again, not knowing the diagnosis, that's hard to, I can't really give you any medical advice over the internet that way. Awesome. I'll check that out as I have the mutation. Oh yes, please check it out. How much biotin for nails and hair? Usually if you buy a B complex, you're going to get adequate biotin because it's in there. It's B7. If you use my multivitamin, it's in there. A lot of times they'll supplement like 100 to 200 times the RDA, which is just fine. But most B complexes have biotin in them, so I would just check and use what the recommended dose is there on the bottle, because they'll have the bottles. Some companies will have the RDA. Some people have like 300 times the RDA. It really depends. I think our vitamin has 200 times the RDA of B12 and biotin in it. I think I have to look back. I can't remember what the exact amount is. Let's see. The challenge is we had to put everything we put in our vitamin. We had to make sure we used the adequate dosages, but we had to thin some of them down. We couldn't do large amounts in some cases because we couldn't fit all that into the capsules. And there's actually 6 capsules with that vitamin. So we do 3 in the morning and 3 at lunch. And so it can be a challenge with our vitamin. And I know we modulated the amount so we could get everything into it. If you take a Centrum, it is impossible to put everything that's on that bottle in that one little capsule. Physically impossible. And unfortunately, there's no regulation on vitamins. And so that's one of the challenges too. What about collagen for hair and nails? Vicky, if you eat eggs and you have red meat, you're getting all the collagen you need. If you're buying collagen can actually stimulate an insulin response. So I would not be adding extra collagen for hair and nails. You really don't need it. You're going to get the biotin from the fat. You're going to get the biotin from the egg yolk. You're going to get it from a regular vitamin if you take that too. But there's no need. I find no need to add extra collagen. The only reason collagen became popular is because a bunch of people eat vegan and vegetarian diets and they never get collagen because they don't eat animal fat. That's really where it comes from. If you're vegan and vegetarian, absolutely put your collagen in there. But if you're not, don't worry about it. You're just buying someone's boat. How long before you see the effect of berberine? You'll see berberine's effect within a couple days, but it is cumulative over about 2 to 3 weeks. Let's see, collagen, necessary a waste of money? Waste of money in my perspective. Any idea when we'll level off? Here in Arizona, I have no idea. They were saying 1 to 2 weeks, mid-April is what they was they're thinking when the peak would be. Don't know yet. Can I order your vitamins? Yes, you can. The easiest way to do is actually order them online. Go to ketoliving.com and they'll ship them right to your house. In fact, I think they give you a discount if you do the auto ship. Dumb question. Are gummy multivitamins absorbable and good quality? I'm not sure about the VeraFusion brand. I've never looked at that brand, Raymond. So I don't know the answer to that one. The challenge is most gummies contain sugar or some form of sweetener that you have to be real careful of. So I'd be wary of that. I'm not sure what you're referring to on those, Kathy. Let's see here. Can I eat too many eggs? That's like asking, can you eat too much bacon? No, you cannot. You're very welcome, guys. All right. Well, it's late. It's 9:30. Some of you, it's past your bedtime. It's getting to be close to past my bedtime. So I'm going to close off here. On metformin, 1,500 milligrams for PCOS is berberine better. Kathy, there is a study that was done that showed that berberine outperformed. If you took berberine 3 times a day of the 500 milligram dose, and they compared it to 500 milligrams of metformin 3 times a day, the berberine actually outperformed it in regards to weight management, blood sugar control, and symptom relief from PCOS. So yes, I do personally, based on that study, think that berberine, if you get a good quality source, is more effective. Do you ship to military postal addresses overseas? That's a good question. I don't know the answer to that. You'll have to. There's an email address there. You can ask the company. I think they do. Because it's a huge company that does it for us. So I think they do ship out of state, overseas. But check. Don't quote me on that, Allison, because I don't know the answer. You're very welcome. Thanks again for great infosis. You're welcome. All right, guys. Well, I'm going to close off. You guys have a great evening. Remember, excuse me, keep the fat high, keep the carbs low, pass the bacon, and don't take toxic vitamin A levels. That's bad for you. And don't take nutrition advice from politicians. That's my word of the day. Have a great evening. I'm going to sign off. Take good care. Good night.